Good afternoon, everyone. I'm Debbie Hart. I'm the President and CEO of BioNJ, the Life Sciences Trade Association of New Jersey. I'd like to thank you for joining us today, hopefully from the safety and comfort of your own homes on this snowy day, as we release the New Jersey Biopharma Industry, a prescription for growth, a BioNJ white paper. So our report examines the health of New Jersey's biopharma industry, draws on economic analysis, as well as discussions from stakeholders from across the New Jersey biopharma ecosystem. Maybe some of you participated in those conversations, as well as case examples of other centers of activity in the industry. So the goals of the paper are to create transparency around New Jersey's strengths and many opportunities, and lay out pragmatic recommendations to promote economic growth across the state through the biopharma industry. So before we get started, I'd just like to go over a couple of housekeeping items. So this is a listen-only webinar. However, we encourage you to submit your questions via the dialog box on your computer screen. We'll have time at the end to answer those questions. Any that we don't get to today, we will certainly respond to at another in the next 24 hours. Also, there will be a recording of this webinar on the BioNJ website at bionj.org beginning tomorrow. Also, you can find a link to the white paper, which will be live right after today's webinar. So now let's get the program started. The New Jersey biopharma industry, a prescription for growth, was initiated last fall at the recommendation and request and blessing of the BioNJ's Board of Trustees. We are very fortunate this morning to have with us our chairman, and he is going to provide some insights on the importance of the paper, as well as the significance of the timing and the hopes, dreams, and wishes that we have around the paper. So I'd ask you, although we won't hear your applause, please join me in welcoming the CEO of Contravir Pharmaceuticals and our beloved chairman, James Saperstein.
Thank you, Debbie, and thank you all who have joined us here today. As Debbie said, the BioNJ board endorsed the white paper last fall as part of a four-part strategic planning initiative. The cornerstone of our mission at BioNJ is to stimulate and support innovation in New Jersey. And frankly, we believe that we, as a state, must do more in this regard. This white paper is an important step in understanding our strengths and weaknesses and how we can build on those strengths and correct the areas that are holding us back. Historically, New Jersey has been the medicine chest of the world, and we are today, without question, one of the strongest life sciences sectors in the country and even in the world. We lead the nation in new drug approvals, making a huge contribution to the lives of patients around the world. New Jersey currently employs over 120,000 highly educated life sciences workers, and if you look at both direct and indirect jobs, there are more than 350,000. New Jersey is the operating base for over 1,000 biopharma companies. In fact, the sector contributes more than $100 billion per year to the state's output. That is 3.7% of the state's GDP, twice the national average. That's the good news. However, while biotechnology has been a source of positive job growth in New Jersey, the state has struggled to grow this sector at the same rate as other leading biopharma hubs. Debbie will address this more thoroughly along with BioNJ's recommendations for action next in her presentation. You'll hear the opportunities we have to attract more companies and grow revenues. I could speak from personal experience as I've brought 2 companies to New Jersey because of the resources that exist here that are unique to our state. The timing of this study is very important. With a new administration and a new legislature, we seek a renewed commitment of support from our elected officials, not only for our industry, but also for innovation in our universities and in the private sector. New Jersey must regain our competitiveness and our leadership in innovation. Millions of patients depend on us. Our economy depends on us. We're excited about the analysis contained in this report, and I'd ask Debbie now to return to the line to present our findings and our recommendations in more detail. Thank you.
Great, James. Thank you so much. Thank you. So in our first slide, you'll see our context and the goals for today. So late last year, as we discussed, BioNJ set out to write this white paper outlining the importance of the industry and examining the health of the industry. And so again, we're drawing on economic analysis, discussions with New Jersey biopharma leaders, and case examples of other centers of activity in the industry. And what we've done here is we're putting forth recommendations to accelerate industry growth. And our goals for today and beyond are sharing an overview of the findings and the recommendations, sparking a dialogue between public and private sector leaders in the state, and creating a sense of and an actual momentum and inspiring action to strengthen further biopharma in New Jersey as we move forward. Next slide, please. So the themes from our research really fell into 4 categories. And the first is the value of the industry. And we've been talking about that some already. And, clearly New Jersey's home to many of the world's largest biopharma companies. It has a tremendous economic impact in New Jersey. And we believe there's tremendous potential for future innovation and growth and building on what we already have, the natural and the historical advantages that we can capitalize on. So second theme is the trends in the industry in New Jersey. And we do remain a leader in terms of drug launches, and we'll talk about that a little bit more in depth in a moment. However, we believe that New Jersey has the opportunity to do even better, grow employment, grow new startups, build on what we have. Drivers of some of the trends that we've seen are the fact that, New Jersey has lower funding in the category of NIH dollars, SBIR grants, and also VC. And that has been a trend that has changed over time, unfortunately. One of the things that we think is a driver of that trend is perhaps less targeted incentives that focus more on job retention than creation. And again, we'll talk about that further as we move along. And then the fourth theme is positioning New Jersey to win in biopharma. So what's the goal, right? Helping New Jersey companies thrive while also attracting additional companies, creating new ones, and then making sure that they have the funding that they need to move forward. And we've defined a specific set of proposals around that. So next slide, please. So setting the stage in terms of the industry, clearly, again, biopharma is important to New Jersey. It represents 3.7% of New Jersey's GDP, which is 2 times the U.S. average of 1.9%. As we heard from James, it represents more than 350,000 direct, indirect, and induced employment jobs, up from the 120,000 from the direct jobs. And we talked about FDA approvals. So the percent of drugs approved by the FDA between 2015 and 2017 by companies with a headquarters in New Jersey is 29% of all FDA approvals. When you think about the fact that this is a global industry, that's a very significant number. And then when you expand that to look at companies that have even a footprint in New Jersey, whether or not it's a headquarters company, that 3-year percentage moves closer to 50%. Again, very, very significant, like no place else in the world. When you expand a little bit beyond New Jersey and you look at the region, the next 2 metrics, speak to the strength of the region in terms of life sciences papers and patents filed. We are very prolific when it comes to that. When I talk about the region, I mean New York City and the academic institutions there, as well as Philadelphia. And then finally, the final metric on this page is the fact that when you look at the cost of lab space per square foot, when you look at the competitor areas such as New York and San Francisco and Boston, New Jersey is highly competitive at an average cost of $20 per square foot compared to $50 in New York City and San Francisco and $70 in Boston. So we can go toe-to-toe on many fronts with some of these areas. And that's what we're talking about today. So next slide, please. Now we look a little more broadly, and you see this heat map here, and we'll look at it a little bit, line by line, but also as you sort of step back and look, it really tells a story of New Jersey and our competitor states and how, we're going toe-to-toe on many of these fronts, but there are certainly some areas where we can stand to improve. So the quality of our talent, we know in New Jersey, that's the number one reason that companies want to come here. And, we have that in spades, and it's the educational attainment of our population. We're, top of the list, as well as in talent availability. The number of universities, unfortunately, we're not as strong there. However, when you pull in the region, New York City, Philadelphia, we get much stronger and much more competitive. When you look at the quality of life, our educational system, pre-K to 12, is very competitive nationally with great outcomes. On the other hand, our cost of living leaves a little to be desired. However, I draw your attention to, look across that row horizontally, and when you look at the competing states, we're all sort of in the same category when it comes to cost of living. Infrastructure. Specifically, I'll point here to quality of roads. We all know that we have a lot that needs to be done in terms of our infrastructure and the quality of roads. And really, on that horizontal plane, Massachusetts is the only one that scores better than us in that category. Overall GDP, we do find that when the industry is strong in the competitor states, the GDP tends to be strong. VC funding. When you look at, we think that there's a lot that we can do better in New Jersey in terms of VC funding, but when you look at the industry and you look compared to the rest of the country, we are, we're better in class than the rest of the country. NIH funding, we have lots that we can add to that category. And then when you look at the regulatory environment, I'm sure we all know, right? We hear the stories of how difficult it can be to build a building or get a zoning permit in New Jersey. And think about the, minor tweaks that we could make to the regulatory environment that could make a major impact in different towns and across the state. Then in the environment for the industry, so the sector GDP, we're a strong on the list in that category. And the number of biopharma startups, again, we think it's an area where we need to grow. We can grow. There's lots of opportunity for that. When you look nationally, we're at the top of the list, along with those other states that are strong in biopharma. Cost of doing business, probably our weakest link. And when you look at labor costs, utility costs, property costs, and taxes, it's an area where we believe we need to improve, and the numbers tell the story. When you move back up to the value of incentives offered, we're a high scorer in that category. However, again, we're going to make some recommendations today that would include additional. More of a focus on life sciences companies. And so we'll hear more about that in a moment. So next slide, please. So biopharma has been a robust source of employment, but New Jersey really has lagged. When you look at this slide, it shows the history over 30 years, and we have fallen off a bit. And in fact, the trend is a higher level of fall off in the last 10 years in New Jersey. And there are certainly a number of factors at work here. And one is the very significant M&A activity that's happened in recent years in the industry at the bigger companies, as well as a movement of manufacturing jobs out of New Jersey to lower cost places such as Puerto Rico. Also, again, fewer startups. That's definitely a theme here. We're just not competing on that front at the same level that places like Massachusetts and California are. So the next slide, please. So New Jersey biopharma startup activity is lower than its peers. I think I've made that point already, but I'm going to get a little more specific about it. When you look at California, California has had 10 times the number of startups that New Jersey's had, with 885 between the period 2012 and 2015. Massachusetts has had 430, and New Jersey has had 89. And so relative to their size, California and Massachusetts are really leaders. And so during that same period, 4 peer states exceeded the national average of 2.5%. Massachusetts at 7.3, California at 3.9, Pennsylvania at 3.4, Maryland at 3.1, and New Jersey at 2.1. Next slide, please. So major incentives in New Jersey have not been focused on life sciences. So we found that the states that focused their incentives on life sciences, they performed better than those that did not. And in New Jersey, our incentives are very generous, but they're not focused on life sciences, and they're more on retention than attraction. And we suggest that changes in this category could significantly increase the ROI. When we look at places like, specifically on this chart, Massachusetts, their incentives are much more focused on the life sciences, and clearly it has paid off in spades. Next slide, please. So now we're getting to the recommendations that we're making, and we're making them, we're proposing to pull 4 different levers. And the first is direct state government support. So we're recommending providing financial incentives and improving access to funding. Some of these, frankly, can be done at no added cost to the state budget. For example, the angel investor tax credit. That is 10% right now. There's a $25 million pool. If that 10% were increased to 25%, that would bring, we believe, more investors reaping obviously better rewards. It would also utilize the program at its full capacity, which has never happened to date. So we just think there's a tremendous opportunity there that, again, wouldn't cost the state an additional penny in terms of what's in its budget, the $25 million. Also targeting Grow New Jersey and others to life sciences specifically, matching SBIR funds. And again, the report has numerous very specific proposals under that category, and hopefully you'll all take a chance to read the report. The second lever that we're proposing is the promotion of life science innovation and investment. So creating a public-private effort to launch new companies focused on the one hand on mid to late stage drug development, looking at some of the assets that are here in the state in some of the big companies and some of the small companies, and how can we reboot them, how can we fund them. Also, any bolstering of industry, academia collaborations will only help the industry grow and incite startups. And then another thing that we found is that for the states that had a larger number of incubators, that corresponded to a larger number of startup companies, as you might expect, and also, more employment, more jobs, more companies. And so we are recommending that New Jersey look at the possibility for additional incubators. And I am pleased to report, some great news on that front that some of you may be aware of. But, Princeton University's announcement of its incubator will, think of the iconic brand that Princeton is and the technology and the companies that might want to be there to collaborate with Princeton and learn from their incubator. I think that's a tremendous opportunity for New Jersey, along with the Seton Hall, Hackensack, Meridian Health, their activity, the new medical school, the incubators that they are proposing to set up, as well as some of the funding that they are putting into them. And then, next in that category, consider launching a biopharma supercluster with targeted incentives and critical mass. We often hear, the fact that New Jersey doesn't really have a city center, such as, what exists in Cambridge and other places. So we took a look at places like Israel and what they've been able to do. And Israel geographically is about the same size as New Jersey. And in the last 10 to 15 years, their focused efforts have really built a robust industry there that we think that we can mimic here in New Jersey using some of their strategies, along with what they've been able to do in Massachusetts. The third lever is educational and training programs. So making New Jersey the world leader in postgraduate and mid-career biopharma educational and training programs. As we know, clearly more and more jobs will be automated. The marketplace is shifting. It requires rethinking and retraining of some of our people who are already in the industry, as well as we, spin out new graduates and what are the things that they should be focused on. And we think that, the next generation capabilities, things like advanced analytics, the value and market access, the convergence of drugs, devices, consumer technology are really important areas to focus and put resources into. And then the fourth lever is strengthening New Jersey's brand, promoting New Jersey as an attractive headquarters location for international companies, for any company for that matter, promoting the state as an ideal location for clinical trials and development and commercialization. These are all, we believe, golden opportunities for growth. And, as I watch our, governor-elect and with his energy and his enthusiasm and what seems to be a very positive outlook on life and New Jersey, I would suggest that our new governor as an ambassador, as our chief marketing officer, who better to tell the story than our governor-elect? So, and we at BioNJ would certainly get behind him and support him in any way that he might be interested in doing that. So we are just about, that's basically the gist of the report. We're wrapping up. We're happy to field your questions. We'd invite you to write them in. And also, we'd be more than happy, again, our Vice President of Communications and Marketing, Randy Bromberg, is on the line, and Randy and I would be more than happy to have a conversation, sidebar conversation with any of you who would like to learn more. We very much look forward to working with the governor-elect and his administration in their efforts to grow the economy. But before we go to our questions, I would like to thank James and our board for their tremendous support and the ability and the runway to bring this forward. Our Public Policy Committee, a number of our Public Policy Committee members are on the phone. We couldn't do what we do in policy without them. And also our friends at McKinsey, who are so famous for strategy and insights, and their strategy and insights are peppered throughout our work here, and we cannot thank them enough for their boundless data and patience along the way. And then finally, to all of you for making the time to listen to what we have to say at BioNJ. And so I'll stop there for a moment and see if we have any questions coming from the group. Okay. Okay, so here's one. Are you looking to incite more companies to launch in New Jersey, or are you advocating that we compete for existing companies? Frankly, all of the above. We want it all. And we think that there are strategies around early stage company creation via incubators and incentives, and then also later stage company support and attraction, such as targeted incentives and retraining that can help us build on that end of the spectrum as well. Okay. So another question. So what are the next steps? So as I mentioned, we're looking forward. We're just releasing this now. We're looking forward to working with the governor-elect. We also are, many of you know that the Biotechnology Task Force was just launched in the last month. We had our first meeting, and these recommendations will certainly go to the Biotechnology Task Force, and we look forward to working with that bipartisan, bicameral group to hopefully advance some of these suggestions as well. And we're happy to work with any of you to help get the story out and to help think this through. And let's see, so if we had a top 3 from our list, could we rank those items beyond having Governor Murphy as a leading advocate? So I guess I would, go to early stage company creation. I think that's an area that is just ripe for making a difference and growing the economy and the number of companies. And I think creating more incubators and the incentives that go along with that is key to developing that strategy. So that would be certainly one. The things that we need to do to support and retain big companies and smaller companies that are already here are clearly important as well. I mean, it's very easy for a company or its employees for that matter, to move across state lines. So incentives and other policies that encourage companies to come here and stay here, and their employees to come here and stay here as well, I think is critically important as well. And you're asking for a third. I guess the third would be, I think another tremendous opportunity is the collaboration between academia and industry. It's critically important. It's frankly one of the areas where we have not been as strong as other places that have been the leaders. And I think that's an opportunity that's ripe for growth as well. So any recommendations to reduce high costs in New Jersey, such as labor and taxes? Well, BioNJ was a founding member of Opportunity New Jersey, and if you look to Opportunity New Jersey and some of the, the global issues that it's working on, that we are working on through Opportunity New Jersey, I would say that consideration of those ideas, such as things like eliminating, reducing the estate tax, the inheritance tax. We've had some headway along those lines. Paying particular attention in light of the, federal tax reform, paying particular attention to the impact that that will have on New Jersey before we make any additional changes, I think will be important as well. So another question, you mentioned the great things some of our institutions of higher ed are doing, but I also said that they lag compared to other states. So this seems to have always been a problem. What else can higher ed do? Seems like it's been doing a lot. I couldn't agree with that more in terms of what they have been doing. It's really, I think it's extraordinary when you look at each and every institution, looking at Rutgers and the UMDNJ merger and, the kinds of thinking and policies and strategies and actual things that have happened as a result of that one, monumental, but that one change. I think it's landscape altering for New Jersey. When you look at Princeton and now the view that they have taken in terms of, wanting to be more entrepreneurial, wanting to be more engaged and supportive of the community, building this incubator. I think that again, Princeton is another example of a leading institution doing more and creating better opportunities and more of everything for New Jersey. I think Rowan is another one. And again, I'm not going to be able to name them all here on this call, but literally each and every one of our academic institutions, I think, has seen the opportunity and is looking inward and looking outward at the same time and trying to be different, make a difference, and is in fact doing that. Again, Rowan, NJIT's been, at this game for a long time as well. Hackensack University Medical Center, now Hackensack Meridian, partnering with Seton Hall to form the medical school, I think is, again, a game changer for New Jersey. So I'll pause and see if we have any other questions coming in. Okay, so you say that we need a public-private sponsorship to attract new companies. Are you recommending that the new governor retain Choose New Jersey? So BioNJ, we have enjoyed a tremendous relationship with Choose New Jersey, have worked very productively with them. We partner on our annual meeting at Bio. We work very successfully with them. They've been very successful, and we do believe that a public-private partnership has proven effective. We certainly leave it to the governor to put his own stamp on the program, but I guess the message that I would leave is that we do support a public-private partnership. We just think it makes sense, just brings more tools to the arsenal, and help the cause all the way around. So. Okay. Okay, and then I guess one last question. How will we pay for this? So, some of the things that we talked about there were tweaks to existing programs. Some are a redistribution of existing allocations. Some, may require new money. And what I would suggest is that, we really take a strategic look. The states that have really done it well, North Carolina, back in the day, Massachusetts, they've taken a strategic approach. So let's do that. Let's develop a strategy that attracts companies like Google and Microsoft and Apple and Facebook and others who are getting into the life sciences, as well as additional facilities of the companies that are already here and their sister companies around the world, both large and small. So I think strategy is the answer. So with that, I don't see any additional questions. I would like to thank you for joining us today. If it didn't come across, I am very bullish on New Jersey. I see nothing but opportunity. And I do hope that each and every one of you will do whatever you can to speak well of New Jersey, make a difference in New Jersey. At the end of the day, this industry is all about bringing therapies and cures to the patients who need them, and is doing it very successfully. And let's just do more of it and do more of it here in New Jersey. I'd like to thank you. Stay safe, stay warm, and have a great day.